Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Virgin Islands veterans, I'm standing here on Veterans Drive, built in honor of us, Virgin Islands veterans. But we now must do our part to bring more VA medical benefits to our shores. How can we do that, you may ask? Get on www.va.gov and get registered. This is the way that we can do our part. Get registered at www.va.gov. We're counting on you.
Vaccinate yourself, now we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be old. If you from the VI and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, let we go.
Welcome to the Government House weekly press briefing and COVID-19 update for the week of August 30th. With me for this afternoon's update is, of course, Dr. Ty Hunt Caesar on behalf of Health Commissioner Justa Encarnacion for the latest COVID-19 statistics and where residents can get a free test and the vaccine this week. Also joining us this afternoon to announce the winners of this week's Vax to Win special drawing is the Assistant Executive Director of the Virgin Islands Lottery Office, Mr. Dwayne Benjamin. I want to say, before I go to Dr. Hunt, that I want to ask the entire Virgin Islands community to join us in prayer for the people of Louisiana and Mississippi, especially our many fellow Virgin Islanders who reside in those states as they begin the rescue, recovery, and cleanup effort following Hurricane Ida. Our community knows all too well what it's like in those days immediately following a storm like a Hurricane Ida. And so I ask all of you that you send a special prayer for everyone impacted. We are in the height of hurricane season here in the Virgin Islands, so please make sure that you take time right now to prepare if you have not done so already. Get at least 3 days worth of food and water, and make sure you fill any medication that you're going to need along the way. Remember, sign up for alerts from VI. Alert VI is at vitima.vi.gov. And to get the latest weather updates and all the information related to storms, our responses, and yes, to COVID. But build your hurricane preparedness kit, make a plan, and make sure your loved ones and your neighbors have a plan too. If you need assistance in building your hurricane preparedness kit, Vitima has a whole wealth of resources available online at vitima.vi.gov. Last night, we lost the 54th Virgin Islander that succumbed to this coronavirus pandemic. The deceased was a 61-year-old woman from St. Thomas who had been hospitalized at Roy Lester Snyder Regional Hospital. Our heartfelt condolences go out to the loved ones of that young lady and all others who have suffered as a result of coronavirus. I pray for the God's grace and mercy for our residents fighting their best against the virus in our hospitals. I pray for God's protection over our doctors and nurses and healthcare workers who tirelessly and selflessly work around the clock to provide these treatments that save as many lives as possible. Tregenza and I urge you to continue doing the things that can prevent you from becoming infected and to take advantage of the vaccines that can reduce the severity of your illness and prevent your untimely death. Now we'll go to Dr. Hunt Caesar. Dr. Hunt?
Good afternoon, and thank you, Governor Bryan. As of August 28th, a total of 167,344 tests have been conducted in the territory. Of those tests, 5,848 individuals have tested positive, and 161,496 tests have tested negative. The 7-day positivity rate is 2.76%. There are currently 269 active cases in the territory, 152 on St. Thomas, 101 on St. Croix, and 16 on St. John. 5,526 cases have recovered, and unfortunately, there have been 54 fatalities. Since we confirmed the presence of the Delta variant in the territory in late July, we've lost 21 community members to complications of COVID-19. The most recent person, as Governor Bryan said, was a 61-year-old female on St. Thomas. None of the people who died were fully vaccinated. The Delta variant is highly contagious and lethal. We should be getting closer to herd immunity or community immunity, but instead, we are unnecessarily burying loved ones and friends as these deaths can be prevented. We are so fortunate to have access to COVID-19 vaccines, unlike many developing countries around the world and even in the Caribbean. The vaccine is the most effective tool we have. Immunization combined with social distancing, hand washing, and mask wearing will continue to decrease our positivity rate, and we'll be closer to seeing the light at the end of the tunnel, ending the pandemic within the territory. I provide direct patient care to those hospitalized with COVID-19, and it is disheartening to see my community members struggling to breathe and fighting for their lives. I would like to extend condolences on behalf of Commissioner Encarnacion and the Health Department to the family and friends of those we have lost to COVID-19. The hotline is open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases at 340-712-6299 or 340-776-1519. From our hospitals, JFL Hospital and Medical Center reported 5 COVID-19 admissions, with all 5 patients ventilated, and SRMC, or RLS, reported 10 COVID-19 admissions with, I believe there are 4 patients ventilated. I will fact check that for you. The vaccines are working by reducing infections and preventing severe illnesses and hospitalizations. Our hospitals continue to admit unvaccinated individuals with serious illness despite us having the tools to avoid this. Those who have pre-existing chronic illnesses are more at risk for severe illness and hospitalization. Let's talk about monoclonal antibodies. We are privileged to have access to monoclonal antibodies just as we are privileged to have access to the vaccine. All individuals who test positive for COVID will receive a call from the contact tracer and the members of the monoclonal antibody infusion team to be screened for eligibility for this treatment. Monoclonal antibodies are molecularly developed antibodies derived from COVID-recovered patients that can be transfused to those with mild disease to prevent progression to severe disease. This treatment is life-saving, but only effective when given very early on. Therefore, you are encouraged to accept this treatment when the treatment team contacts you. We have seen more treatments in St. Thomas than in St. Croix due to the higher numbers of cases in St. Thomas. However, we have also seen several people declining treatment, but then requesting it after they fall out of treatment eligibility window. Please do not decline this treatment, this critical treatment, if you are contacted for the treatment. We have been successful in preventing hospitalizations and death with this medical countermeasure. Those who have had monoclonal antibody treatment should still get the COVID vaccine 90 days or 3 months after receiving the treatment. If you have had COVID-19, there is no need to wait for a certain amount of time after recovering from the disease to get the vaccine. People who recover on their own from COVID-19 can and should immediately get the vaccine upon full recovery and lifted from quarantine. We offer free vaccines at our community vaccination centers and other locations throughout the community. We have been partnering with other government agencies, nonprofit organizations, and businesses around the territory to make vaccines more accessible. Herd immunity or community immunity, we mention that a lot. When do we get there? Right now, we are at 47.3% of those who are fully vaccinated. That means we need at least 22.7% more of our population to become fully vaccinated to reach community immunity. Why? The Delta variant, as well as other variants of concerns, have emerged because the majority of the population remains non-immune to COVID. Simply stated, if the virus is circulating and there are people who are not immune, the virus will continue to infect, spread, and potentially change to a stronger, more potent virus. The majority of the population, or at least 70%, is necessary to effectively stop the spread of COVID amongst each other, ending the likelihood of severe disease and death. Please go to our website for further information on where you can get vaccinated and where we have events set up for with partnering mobile vaccinations. To get vaccinated, please call 340-777-VAX or 8227, or simply walk into our community vaccination centers. You can also schedule an appointment online at COVID-19USVI.com/vaccines. Families can also call the hotline to schedule an appointment for homebound relatives. Our mobile strike team will come to the homes of homebound individuals. If you are a parent or guardian of a child age 12 and up, please make sure to accompany your child to his or her vaccination visit and bring an ID for both the child and you, as well as the child's birth certificate. This is extremely important to ensure that we validate that you are the parent of the child being vaccinated. To schedule an appointment for a COVID-19 test, please call the epidemiology hotline. The hotline is open 7 days a week from 8 a.m. to 10 p.m. I have already said the numbers. You can also schedule an appointment online at COVID-19USVI.com/testing. Pop-up testing on St. John is available at the Vipa gravel lot on Wednesdays 1 to 4 and are available on Tuesdays and Thursdays in the St. Thomas and St. John districts. The locations are always constantly on our website. I want to remind you, if you are a COVID positive or close COVID contact, stay at home. It is important to decrease the spread, especially to the unsuspected, more vulnerable Virgin Islander who may contract COVID from you, be admitted, and die. Remember, our highest mode of transmission is community spread. Also, the Division of Environmental Health reminds the public and businesses that approval is required to hold special events outside of what is allowed through the executive order. To request to hold an event, party, or function, a special events request form must be submitted at least 14 days or 2 weeks before the event. And lastly, a big congratulations to our vaccine lottery winners. Don't forget the Healthcare Heroes special drawing will be held on October 4th. The last date to register is October 1st, and you just have to go to the vax2winusvi.com website. to make sure that you register. To keep up with the latest information, please visit the USVI Department of Health Facebook page or visit the COVID-19USVI.com webpage. And for health information, you can sign up for text alerts at, you have to text COVID-19 USVI to 888-777. And before I turn it back to the governor, I want to again extend condolences to the families who have lost loved ones to COVID. However, I must remind you that the vaccine has been available to the general public since March 1st. All of our deaths have been among unvaccinated individuals. Deaths in the most recent months have been preventable. Remember that the vaccine prevents against all variants, the one you have gotten infected with and the one you can potentially be reinfected with. Regardless of having COVID in the past, you are still encouraged to be vaccinated immediately after recovery or 3 months after monoclonal antibody treatment. Thank you, Governor Bryan.
Thank you, Dr. Hunt. And I think it's so important for our community to note that we've now had more deaths since the issuance of the vaccine than before it. And we always say, if, these are unnecessary, we need to go ahead and get the vaccine. I can't say that enough. COVID is ravaging our community in so many different ways, and certainly we know about health-wise, but economically as well. While many people in the territory are doing well, we have a lot of people that are still not really doing well. And we can tell by the high incidence of unemployment that we're giving out, the people that are applying for social programs like welfare and food stamp, the continuation of PEBT, all the things that are going through, it tells us that our community is still struggling. And we're doing everything that we can to assist, from scholarships for kids to paying light bills for people. But today I'm especially proud to announce that clients, and it's mainly landlords, and I want to thank the landlords for working with us and with our people, but they've begun receiving their payments under the Emergency Rental Assistance Program. As originally conceived by the federal government, it has been very difficult to implement this thing across the country, but the Virgin Islands Housing Finance Authority has worked out the kinks, and they are now prepared to make steady progress on this critical support for families that are facing hardships and most likely eviction. While many locally may be of the opinion that this program was a little bit slow in being implemented, understand the fact that it's over 80% of the jurisdictions in the United States have not been able to get started and get this money to people. Up to last week, we sat in Congressman Clyburn's office trying to understand, and from him, how we have not been able to do this. So in doing and making sure that we can get this to people, I want to make sure that I stress to you, first, there's no way that we're going to spend all this money. We're leading an implementation, but we have $39 million. And because of the federal guidelines, we will never get to the end of it. But you could help, though. I want to urge each and every one of you to take advantage of this program, as it can be used for not only your rent, but your internet, water, electricity. The program pays up to a year in delinquent payments and 3 months into the future. And I know a lot of you Virgin Islanders out there are prideful, but swallow your pride. This is what this money is meant for. Go out there and apply for this money and make sure you get it. For more information on the VI Emergency Rental Assistance Program, or to get an application to see if you qualify, you could go to erap.veihfa.gov or contact the Housing Finance Authority at 774655. To date, at least 49,919 individuals have been vaccinated in the territory and are eligible to win our weekly cash drawings of $100,000 per district. Here to announce the winners of the Vax to Win drawings is Mr. Dwayne Benjamin, Assistant Executive Director of the VI Lottery Office. Dwayne?
Good afternoon. Thank you, Governor. Good afternoon, Virgin Islands. This week winners for the Vax to Win lottery from the Island District of St. Croix, Jarrell O'Connor, who will receive $100,000 as she is fully vaccinated. And the winner from the St. Thomas St. John District is Ms. Segunda Freilinger, again receiving $100,000 for being fully vaccinated. Next week's Week 8 winner will be announced at our next press briefing next week, Monday, hopefully at the same time.
Well, that's...
Again, thank you for participating, and I urge all other individuals who have not been vaccinated that you still have an opportunity to enter the Vax to Win lottery. Thank you, Governor.
Thank you. That lottery win certainly changes lives, the $100,000. I want to remind the public that because we had that short drawing on the 1 week where there was only one shot administered to the recipient, there was an extra $50,000. So we'll be drawing an extra 5 people who will each win $10,000. We should have those 5 winners for you next week. Congratulations again to Ms. Jarrell O'Connor and Ms. Segunda Freilinger. Thank you for taking your best shot and doing your part to help protect our community. Don't forget that there is a special drawing just for healthcare workers and allied healthcare workers. So this includes nurses, physicians, paramedics, etc. If you want to register for this drawing, you can do so online at VaxToWinUSVI.com or call in the Vitima hotline at 777-8227 or in person at any of Department of Health's community vaccination centers or the St. John Administrator's Office. First prize, $25, second prize, $10, third prize, $5, all thousands. 3 winners will be chosen from the St. Croix District and 3 winners from the St. Thomas St. John District. So while we have been battling this pandemic for the last year and a half, you know, there is another pandemic that is plaguing our community, and it's taking lives all the time. This pandemic has been plaguing us and many others in places all over this country. It has reared its ugly head more than ever during COVID. It's called gun violence. It has increased over 40% nationwide. You know, each life, regardless of how it was lived, within the law or outside the lines of the law, is priceless. We as a society have to work together to bring killers to justice. Now, I live in this community just like you, and I know the fear and trepidation one faces to come forward and the reality of what that means living in that community. And we have decided to add some support to those that find the courage to come forward and save our society and represent in keeping our streets safe. Today, I'm announcing an award of $1 million to a fund specifically to address homicides and armed robberies. From today forward, we will be awarding $50,000 for any information that leads to the arrest of a homicide suspect, and $25,000 for any information that leads to the arrest of a armed robbery suspect. This is just one initiative that we're going to be announcing to help and assist and encourage our people to do the right thing and testify against these people who are terrorists in our community. We are counting on you to make sure that we can get this done. You know, all the support that's necessary to our police officers and the other people in the territory that work under law enforcement, going to help, because we believe that we have to get a grip on this problem, and we have to get a grip on this small group of terrorists in our community. Over the next couple of months, you will be hearing initiatives from not only me, but your commissioner of police and your chiefs of police to fight this crime epidemic that we're facing. We will stomp it out, and we will be successful. Now, when you talk about what we've been seeing in the last 3 months with the Delta variants, we had a strong position about getting students back to school. And rest assured, our utmost priority is returning our children to the classroom. As a parent, I sit many a nights and I think of the challenges that people in our community with young children are facing today. Single moms, dads, sometimes grandpas and grandmoms that have to go to work, but they still have to figure out what to do to ensure that their children get educated at home while they're not in the presence. Equally as troubling is the infectiousness of the Delta variant and its proliferation among children on the mainland. I do not want our children to be exposed unnecessarily. I think about the long-lasting effect that this will have on their educational growth because they've missed so much in the last year and a half. But we have to move forward. We have to make sure that we are constantly pressing forward because the virus doesn't seem to be going anywhere soon. But forward must be with the health and safety of our children and educational staff, teachers, and everybody else. Safety first. The Department of Education is currently making plans to resume in-person learning for pre-K to third grade. CTEC, special education, and everybody else involved in those. So that's pre-K to third, CTEC students, and special education students. That is scheduled for next week, September 7th. Students in grade 4 through 12 will continue to learn virtually for now. But we're pressing to get them back in school soon too, because there's other things that are associated with them not showing up as well. A lot of our children don't get a solid meal every day and depend on the Department of Education for breakfast as well as lunch. So we're going to make sure we do all we can, and the No VI Child Goes Hungry Feeding Initiative will continue territory-wide. Parents and guardians of students engaged in virtual learning may pick up breakfast as well as lunch Monday through Friday between the hours of 9 to 11 a.m. As long as we have food, we will continue to give it to the students and parents that show up. Students attending classes in person will be provided lunch and breakfast in school. Well, in other non-COVID related news, this past week I visited the nation's capital in Washington, D.C. to meet with lawmakers in Congress on several matters important to the territory. One of those matters focused on increasing the amount of highway funding that is allocated to the territory. Currently, the territory has been consistently receiving about $16 million for the upkeep of federal roads and other transportation infrastructure. This amount has been the same for 30 years. While I was there, I have to say, joined by the Delegate to Congress, Stacey Plaskett, who has an awesome staff, and I think that together we make a pretty dynamic duo going to representatives on the Hill and senators as well as officers, trying to get our point across. We met with Congressman Rosa DeLauro, who chairs the House Appropriations Committee, as well as Congressman James Clyburn. We made inroads, and I am hopeful that we can get this formula changed so we can get some more money into the territory to take care of these federal roads. While I was there in Washington, we also lobbied for the Medicaid cliff extensions, which comes to an end this fall, and with officials from the Department of Treasury that we know can help us in terms of the policies that would be benefit to get our tax incentive programs running again, and also to allow us to be able to do some things around refinancing the government's debt. In closing this afternoon, I have to say, working with the delegate in Congress, we have been able to accomplish some incredible things. I think both she and I have a commitment to eradicating poverty in the territory. And this year alone, we have been able to get the earned income tax credit refunded, which is huge. This means that your tax payment, your tax check is going to come even faster next year, the year after that, and the year after that. Something that we have been working on for over 20 years now. Or the child tax credit that you're getting, people should have already gotten checks, $300 per child. Congresswoman DeLauro, big champion. She couldn't believe we were not included in a lot of these programs, got us included because of the work we've done on the Hill. Big win again. The Medicaid cliff. Right now, we're scheduled to be able to get a reappropriation for 8 years. As you can remember, we got 2 years in the first year, but now through the work of the delegate, a lot of pushing in Congress, we now gonna set up to get 8 years of reappropriation, which is fantastic. And all these things affect poor people. These are the things that help and strengthen our society and our community and be able to support working families that are really out there struggling. And that's why we have made that commitment to pay taxes back. All the money that we're giving back to the public is to bring our community out of poverty and be able to give this money back. And that's why today, again, I'm glad to say that the BIR, the Bureau of Internal Revenue, will be issuing another $10 million in tax refunds this week as we slowly but surely catch up, because we want to get current, so when you file, we pay. That is the goal of the administration. So it should address all of the pending 2018 returns, anything prior to tax year 2018, and those 2019 returns that were filed during the first 2 months of last year. So if you filed during that period, you got a return coming for 2018, that tax check should be on the way. We're going to continue to pay people as we signed the 8% last week before last, and we're getting ready to put all the paperwork together to get that out to you. Rest assured, you're going to be included. It's what we owe to the people we want to pay. And we'll have much more announcements as the time goes by and our treasury gets stronger. So work with us and just have a little patience, but we're going to get that check to you right when you need it the most. I'll take some questions from the public now, from the press now. Diana Diaz from the VI Source. Go ahead. Diana Diaz, VI Source. Susan Carlson, VI Daily News. No questions? Kay Wicker, St. Croix Avis.
Good afternoon. Can you hear me?
Yes, ma'am, I can hear you.
Great, great. So my question is a little off topic. It's about horse racing. Siba and I, we've both been looking for just more information on what's going on there. And we wanted to know if you could share any information on why there's now an additional 60-day delay to a decision with what to do with Clinton Phipps.
Thank you for that. We have a preliminary agreement with Southland Gaming. That agreement has a lot of moving parts to it. Right now, we're reducing that agreement to legalese. It's going to require us to go back to the legislature to get some stuff changed. And we just need the extra time so we can put that forward, because in order for the settlement to be in place and guarantee horse racing again for the St. Thomas district, we're going to have to get some concessions from the legislature. So as soon as that is finished, which I anticipate which should be in the next week or two, we're going to make an announcement and then present it to the Senate for ratification and move on from there. But rest assured, it's going to be good.
Okay. And then real quick, my last only point about horse racing is, can you give us an update on what's going on with the Randall Dock James racetrack here?
The Randall Dock James racetrack, I think we were supposed to do a groundbreaking this month, August. I have a feeling that the Delta variant may have postponed things a little bit, but construction should be starting there if it hasn't started already with the the finishing of the laying of the track, and then we've had all the horse owners supposed to be vacated now, and then the heavier construction that involves the barns, the bandstands, and everything else should take place. I'll check up on that, but I was under the impression that he had started, and we just didn't do anything because of the Delta variant.
Okay, well, thank you so much.
Thank you. Susan Ellis? No questions? Ernest Gilbert?
Hey, Gov, can you hear me?
Yes, I hear you fine.
Okay, a few questions, Gov. Some from community members there, so let me get this one here. Folks have been going to the, folks want to know how exactly they get paid. So I know you're relative to the $250 incentive. We explained this already, but I think what people want to know now is how exactly are they supposed to get the money?
They're going to be issued a, I think I said this before, but they're going to be issued a bank card. We're working with the banks right now to give you the special gold card, and then you will be contacted by the Department of Health. If we have your address, it'll be mailed directly to you, so you can get that incentive and get going. Those should be available within the next 2 weeks or so. If it is any delay further than that, we're just going to start cutting checks through the Department of Finance.
Okay, thanks for that. Another question is, the Department of Health recently announced the availability of a third dose vaccination shots for the immunocompromised. We've gotten a number of calls because they read that article on Consortium, a press release the Department of Health sent out, and they've said that they've went to these vaccination centers, both public and private, and they are being turned back. When will it become available, or what is the information on that?
I'll let Dr. Hunt answer that one.
Thank you for that question, and I do apologize for any misinformation or mix-ups in the community. So yes, we actually presented and provided direction and guidance to all of the vaccination providers, including the CVCs, informing exactly what the procedure is regarding the third doses for the immunocompromised, as well as the boosters for the general population, which is not yet available. So the third dose, anyone who is eligible for receiving a third dose should receive a note from their physician, provider, or prescription, and present that to the vaccinating provider or the CVC or the community vaccination center, and they will be issued that third dose. So it has to be something that the vaccinating provider can use to validate that they meet criteria in the form of the note or the script, and then you need to make sure that they are indeed at least 4 weeks from completing the first 2 shots or the second shot. So that's the procedure.
All right, thanks for that, Dr. Hunt. Governor, some quick questions here. We are learning that both hospitals, the Schneider Regional and GFL, have had they've run out of oxygen there a couple of times. Have you gotten an update on that situation, and why are the hospitals facing this?
I can also take that. So we have sort of daily updates with the hospitals, and at least 3 times a week we actually have a joint hospital huddle in which we talk about all of these events, including oxygen, and that is a misconception that the hospitals ran out of oxygen. When the hospitals did indeed meet, when they do meet on critically low levels, we do have conversations and how to source, and we ensure that the patients actually do get the oxygen that's needed. And for example, we shift to different procedures. When you have elective procedures that can be canceled, that's what we do. So we go over the critical needs of the hospital on a day-to-day basis, and the Department of Health is going to ensure that we have procedures and policies that are a little bit more formal, so that we can regulate and ensure that we are overseeing when oxygen needs to be ordered in from various companies. But we are pleased to say that the hospital at GFL, at RLS, actually does have an oxygen generator that has been certified. So critical shortage of oxygen should not really be an issue and a concern moving forward within the territory. But the hospitals did not run out of oxygen.
JFL did not.
JFL did not run out of oxygen.
Okay, thank you. Um, Dr. Hunt, you mentioned we're trying to get to a 70% vaccination rate there in order to achieve herd immunity. Um, uh, when you look at the states and what certain scientists and health officials are saying, some are saying you need even greater numbers, up to 80% or higher, to actually achieve proper herd immunity where you would not see spread like what we are seeing now. Um, what is your stance on that?
No, that's correct. My stance on it is that we need to achieve the maximum number possible. So we need to have at least 70% as the next immediate goal post. And then, yes, because we have significant variants that are emerging, then we want to have at least 85%, of our population vaccinated. But really, the goal is to get as many people vaccinated as possible. So, the number varies. When you do different statistics and you look at different models, you'll see anywhere between 70 to 90% is when you can achieve effective herd immunity. And the science and the data continues to, to change and evolve with this novel infection. So now we want at least 70%, but the answer is we'll get there when we get there. We can get to a number and then all of a sudden we'll just start to see, a few cases that are popping up. So it's an at least number, and we're not going to know exactly when we get there until we get there.
Thank you, Dr. Hunt. Gov, a few more questions, quick shots there. Thank you, Dr. Hunt. Governor, the Supreme Court, of course, throughout the President Biden's and CDC's eviction moratorium there, and they ruled once and for all on that. You just mentioned that the funds are finally starting to go out to landlords. Where do we stand on that matter locally? Of course, with the Supreme Court's ruling, local landlords may now take action to basically evict tenants who've been owing monies,
That
right?
is totally untrue. That is totally untrue. The Supreme Court rejected the president's mandate. They didn't reject mine. They rejected that premise on the powers due to the President of the United States and the CDC. The Virgin Islands is governed by the Organic Act. The powers due to the governor under the executive privilege of a state of disaster or emergency. So the current order in place in the Virgin Islands is under the mandate of the governor of the Virgin Islands, which restricts people from evicting tenants that are past due on their rent if they have a valid application in at the ERAP or the Rental Assistance Program. That's what the mandate here says. No one has challenged that mandate in court, so it stands.
Right. So if someone challenges it, then the outcome might as well be the same, since the Supreme Court rejected that of the president.
No, every case is tested on the merits of the case. The governor of the Virgin Islands has specific privileges and powers under the Organic Act of the Virgin Islands, and the laws are different in Virgin Islands. And when I always caution people when they read, when they hear these things, that they need to go and read what the Supreme Court actually said. This is a good opportunity because I hear a lot of people in the community saying that they're owed stuff for the 8%. The government of the Virgin Islands only owes the steel workers and the AFT for the 8%. The court ruled that the Virgin Islands government bargained in bad faith, and therefore they owe these unions back their money. They said on the face of it, the reduction of the salary by 8% was legal. So if you look at what we're doing now, we have chosen to pay everyone back the 8% because we now have the resources and are able to do that. But it wasn't because the 8% was illegal. And that's why it's important, I think, to read the conclusion of these cases to understand that. And then understand that in the Virgin Islands, even though the Supreme Court made a ruling, they didn't make a ruling on a Virgin Islands law. They made a ruling on the mandates of the CDC that is not as specific as ours, whereas we're saying It's only valid if you have application into the ERAP. So if you're evicting a tenant because they smoke in their apartment, or they have pets, or they make too much noise, or they violated how many people could be on the lease, that's perfectly legal. You can evict them for that. But all we're saying is for people who have applications in, that they're barred from letting those people, from evicting those people. And until that's challenged and overturned by some court, the rule stands.
All right, Governor, quick, I'm gonna ask a follow-up to that, and then a last question on the funding for the crime situation. You've said that it's been difficult to deliver those funds, but we haven't gotten an explanation as to why. What is bottlenecking the process of getting those funds to landlords?
What is the difficulty? First of all, we had to get the authorization and the rules from the federal government. Then we have to create a program to distribute these. As you know, I was explaining this because it's important that states like New York, they don't have to distribute the program. They distribute those programs to the counties. And then the counties each create their own programs, and the cities create their own programs. Here in the Virgin Islands, we have to do it. We are the city and the county, so we have to create those programs and then distribute them. Then you got to figure out what are the local rules and regulations you're going to apply in distributing this. You have to collect all the information, what information is applicable in this, and then you have to make a lot of judgment calls because there are income requirements that are still in place for people who are getting this program. So when the federal government announces it to us, they say, oh, everybody's going to get rental assistance who's affected by COVID. But when you look at the fine print, then you realize that you had to be this under this income level, or you had to be affected in this way in order to be eligible, which is a tragedy because we have so much of this money to distribute. It would be great if we could just pay people's rent. And then remember, this is essentially a landlord program. It's not a renter's program. It's the landlords who are getting justice. So the landlords are the ones that really apply. They have to agree to participate with the program, give up tax information and all kinds of other stuff. And people get, a little antsy about giving the government information, especially on the behalf of their tenants. So it's been very difficult. It's difficult nationwide. And, speaking to the Representative Clyburn, they're looking to see how they can make it a little simpler,
All right, Governor, one last question here. I'm gonna just bungle two in there. Where is the funding for the $1 million initiative on crime coming from? And lastly, you mentioned numbers relative to folks who are on unemployment and the safety net programs. You said those numbers are climbing. Do you have numbers on that so we could get an understanding of where the community is relative to those really going through some struggles right now? And where are we getting the $1 million from for the crime initiative?
We've included the $1 million as an extra appendage in the budget review that we're going to do. So it's in a 2022 budget. But we also have some other reserves that we can use in order to fund it if more money is needed as well through the CARES Act and through ARPA. So the money isn't the issue. We have the money to pay for it, and we're going to power that through. You're asking about unemployment. I think our unemployment rates are actually down. I think they're somewhere around 5-6% now. But that number, that $153 million we've given out, I think it's even more than that. That number continues to grow because people, remember, we are a little bit of a backlog with our programs as well, too. So people are still collecting benefits. We owe them benefits as we bring on more software to make it more automatic to get paid rather than all this tedious paperwork.
So, Governor, the $1 million fund, that initiative goes live right away. Is it live now? When will it go live?
Say that again?
The $1 million crime initiative, when does it go live? Is it live now?
Today.
The funds are ready?
Yeah.
Today.
If you go out, like I could point in colloquial. If you feel like ratting, go today. You get your $50,000. But remember, it have to lead to an arrest. So you can't just give information. You got to be willing to testify against the information if need be, supply some type of evidence, a videotape or something that's going to lead to an arrest. Simply just calling a name and saying, I know this person did it is not enough. We got to arrest these people.
Gov, thank you.
Hey, thank you very much. Kay Wicker, any more questions from the press? I think that's it. Ladies and gentlemen, thank you very much for your time on this blessed Monday. Stay safe, stay sanitized. Love you.